Congresswoman.
3 years ago, my kidneys failed. At the time, I was single, self-employed, couldn't afford health insurance. I was in the hospital 33 days, and by the time I came out, my hospital bill and physician's bills totaled about $160,000. It took me 6 months to get Medicaid to finally approve me for payment of my medical. In the meantime, two of my doctors turned me over for collection, even though I was trying to negotiate a settlement with them. Now I am on Medicare, but my charges for dialysis run $40,000 to $50,000 a month, and yet Medicare actually only pays, it varies, but Medicare pays $4,000, $5,000, sometimes $6,000. I do have supplement coverage now, so I actually don't come out of pocket any, but the dialysis centers obviously are charging higher amounts because some companies will pay that, is their attitude, so they eventually do get some payment back. And then lately, I had a recent thing, I was called in for a transplant. I was physically admitted into the hospital for about 1 hour. I was actually physically in a room for 15 minutes, and the bill that came from that hospital was just under $7,000, which of course was submitted to Medicare. And I called Medicare to make them aware I'd only been in the hospital for under an hour, and I thought it was crazy for them to be paying any kind of a bill even close to the $7,000 figure. And at this point, I don't know whether they paid it or not, but I have gotten a notice from my supplement carrier that they paid almost $1,000, which tells me Medicare must have paid something. And again, it all comes back to the taxpayers paying that. And I don't think most of them know that. I think the average taxpayer out there just sees somebody like me as I'm getting free medical coverage, and it doesn't have any effect on them, and it really does. We're all paying that.